So today, we're going to dive into a technology that's quickly becoming a doctor's most powerful new ally, artificial intelligence. Let's break down how AI is really changing the face of medicine and what that means for you and me as patients.
And let's just start with a really big question. Can technology help doctors see the invisible? Now I know it sounds like something straight out of science fiction, right? But this very idea is at the heart of how AI is starting to reshape everything we know about healthcare.
All right, so first up, medicine's modern challenges. And if you had to boil it all down to one thing, it would be this: the overwhelming complexity that doctors are facing every single day.
Let's break that down a bit. Doctors are dealing with a flood of patients like never before. At the same time, diagnoses are getting way more complex. And on top of all that, there's this huge demand for care that's personalized to you. It's really the perfect storm, and it's exactly why a new kind of help isn't just a nice to have, it's become absolutely essential.
And that brings us to our second point, AI as a powerful new ally. The best way to think about it, imagine it as a second pair of eyes for every single clinician out there.
Now, this isn't about a competition between humans and machines. It's all about partnership. Your doctor brings that irreplaceable empathy, intuition, and real-world experience. The AI assistant, on the other hand, brings raw, incredible processing power. It can sift through mountains of data and spot these tiny, subtle patterns at a speed that's just unbelievable. They don't replace each other, they make each other better.
So what does that actually look like in a hospital? Well, AI is already helping radiologists find early-stage cancers that the human eye might just glance over. It can spot eye disease from a simple photo of your retina, or it can scan a patient's entire medical history in seconds to suggest possible diagnoses. In a chaotic ER, that is an absolute game changer.
But it goes so much deeper than just diagnosing what's wrong right now. AI opens the door to something called patient analytics. And this is a huge deal, because it shifts medicine from being reactive to proactive. It analyzes everything: genetics, lifestyle, health data, to predict who is at high risk for a disease before they even have symptoms.
And that is the whole key. It lets doctors get ahead of the problem. Think about someone with diabetes. An AI can analyze their data in real time, glucose levels, activity, diet, and help fine-tune their treatment on the fly. That's not just better medicine, it's a fundamentally better quality of life.
Okay, but it's not all sunshine and roses. We have to talk about the hurdles to actually implementing this stuff. This is the big reality check before the revolution can really take off.
There are three really critical hurdles to clear. First off, privacy and security. This is our most sensitive health data we're talking about. It needs to be locked down tight. Second, you have to navigate the maze of complex regulations in healthcare. And third, and this one is huge, we have to make sure that data we're feeding these AI systems is fair and unbiased.
And that last point raises a profoundly important question for all of us. What happens when our technology inherits our own human biases?
Because here's the danger. If you train an AI on data that comes from only one group of people, its insights and recommendations could be flat out wrong for everybody else. So instead of helping to fix health inequalities, a biased AI could accidentally make them much, much worse. This is probably one of the most critical ethical challenges in the entire field.
So, how do we move forward? Well, it all comes back to this idea of the human-AI partnership. It's really about redefining the roles everyone plays in modern medicine. The guiding philosophy, the North Star for all of this, really boils down to just three words: augment, not replace. The goal is to build tools that empower clinicians, not to make them obsolete.
And the division of labor here is pretty clear. You let the AI do the heavy lifting with the data, analyze the scans, flag the potential risks, parse mountains of patient records. This frees up the clinician to do what only a human can do: actually talk to the patient, make that final call on a diagnosis, and provide truly empathetic care.
Because at the end of the day, those skills like empathy, real communication, and making those tough, complex ethical decisions, those will always be uniquely human. You just can't write an algorithm for a human connection. So when you put all of these pieces together, what you're really seeing is the beginning of a new era of care. We're looking toward a future that is somehow both more scientific and at the same time more deeply humane. And trust me, the horizon is expanding fast. We're already seeing these advanced diagnostics today. Pretty soon, AI is going to dramatically speed up drug discovery. Look a little further out,
And you're talking about AI-assisted surgical robots and even personalized AI support for mental health. The potential is it's incredible.
But through all this amazing innovation, the ultimate goal never changes. It's to create medical care that is more precise, more effective, and profoundly more humane for every single patient.
So let's end by looping all the way back to our first idea, but with a bit of a twist. We started by asking if technology could help us see the invisible. But maybe the deeper, more profound question we should be asking is this: by taking on the crushing burden of data, can technology actually free up our doctors to make medicine more human again?